All right, next up is following your intuition. And this can be really useful when you're trying to decide what diet should you follow. Use your intuition to help you determine. So intuition is part of our body. It's part of the human body. It's located in the base of the brain, and it's also located in our gut. The base of the brain, we know, is responsible for our survival instincts, right? So back in the day when saber-toothed tigers were roaming the earth and early man had to run from them, the survival instincts kicked in. And of course, today we're not dealing with saber-toothed tigers, but we might be dealing with things that are threatening, like hearing the words, "You have cancer." And that threat puts our brain into that survival mode. So the brain takes over and pulls all of the functioning to what it thinks needs to run from or get away from that threat. And so it's effectively shutting down a lot of other processes so that we can get away from the threat. Now, we also know there are over 100 million neurons, similar cells to the ones in our brain, located in our gut. And recent research has shown that those neurons in our gut can act independently of the ones in our brain, which is why there's truth to that getting a bad feeling in our gut, right? And I recommend that you make it a priority to hone your intuition. This can be easily achieved through a little practice. The next time you feel that feeling, that sinking feeling in the pit of your stomach, or that tingle, or that whatever you get when something's coming up for you that you know isn't your ego, you know it's a little voice within, pay attention to it. Write it down and track it. Keep looking back at that and go, okay, what were the results of that? How did it turn out? Was that feeling justified? So when you get that little feeling of giddiness when faced with another decision, pay attention to that. And if you listen to your instinct, did it pay off? Tracking is going to help you take notice more and more of your intuitive voice, and let your intuitive voice know and your intuition within you know that you want to hear from it more. It's there for all of us. And we probably all know people that are highly intuitive and we think we're not. Well, some people may come wired highly intuitive, but other people become highly intuitive by working on it, by practicing their intuition. This is another one of those factors that you could say could use 5 minutes of practice each day just to keep getting it more and more developed. So the research on this one is pretty fascinating. It was a study done at Cornell, and they looked at people's ability to predict whether a picture was behind curtain number 1 or curtain number 2. Now, the curtains were on a computer, so no actual curtains were involved in this. And the researchers were measuring the subject's subtle physiological responses. Remarkably, they found that the subjects' bodies were able to predict the correct curtain 2 to 3 seconds before the computer had even decided which curtain to use. And the subjects, they didn't always follow through with what their slightly sweaty palms were telling them to do, but their slightly sweaty palms were almost always right. In fact, they even had the ability to predict the future by those 2 to 3 seconds. So if you were a gambler, you might like to have this ability to predict whether a certain card was going to show up. So this study suggests that you should work on heightening your sense of intuition to such a degree that you could recognize when the sweat glands on the palm of your hands have opened up. But if you're not a gambler, you can still utilize your intuition to really help you figure out what's the right thing for you to do. Again, when you're advocating for yourself, listening to that intuitive voice within, which I believe is directly connected to the divine, to the universe, to that higher power, that can really be helpful. Next up is herbs and supplements. And this is the one factor that requires a practitioner's guidance. We really think for safety, you should be working with an expert. And again, no magic bullet here either. It's very individual. It's based on what your particular body needs. But we know from the radical remission survivors that they all utilized 3 main categories of supplements. So they were looking at supplements and taking supplements that help them to detoxify, help them boost their immune system, and supplements that were improving digestion and therefore absorption of nutrients. Now, to get rid of cancer, you really need to change the conditions under which it thrives. All of these healing factors are helping you change the conditions under which cancer thrives. All of these factors are making you a less hospitable host. So you are no longer, letting cancer grow the way it grew. You're changing things to make a difference here. So when you use detoxifying supplements, you're taking vitamins and supplements to help clear the body of toxins, the pesticides, the chemicals, the heavy metals, maybe bacteria, viruses, parasites. Again, it's individual. You really need to work with a practitioner for testing and guidance. You shouldn't do this on your own. And you're going to want to be careful if you are already undergoing chemotherapy or taking medications. You don't want to detox the chemo and the meds. You want to detox maybe before you do chemotherapy or a number of weeks after you complete chemotherapy. Then it's safe to do a detoxification. You also want a practitioner that's going to help you determine if you've got something you need to detoxify. Don't just start taking supplements because you think they're good for you because somebody else is taking them. Find out what you need. Get the testing and assessment that's necessary to know so that you're not wasting time and money on something that your body doesn't need. But supplementation can make up for vital nutrients and minerals that are not often found in today's food supply, and they can help the body detoxify chemicals from our modern environment. But again, they're not a single solution. Now, when we look at strengthening the immune system, we know that conventional medicine tends to view cancer as a hostile invader that the body can't fight off. In contrast, many alternative and integrative healers see cancer as something the body can fight off as long as the body, mind, and spirit system is in optimal condition. And a lot of it depends on the immune system. So the approach of the conventional doc is to kill cancer cells, while the approach of the integrative and alternative doctors is to strengthen your body, mind, and spirit, strengthen your immune system as much as possible. And this is why they may recommend plant-based herbs and supplements that boost your immune system. The hope is that by creating an internal environment that is incredibly strong and healthy, the cancer cells will not be able to thrive. Now, the alternative integrative healers can believe that cancer only can grow and survive in a certain environment, and one that's blocked with stagnant energy, locks oxygen and nutrients, and is filled with bacteria and viruses. So this is why changing those underlying conditions can be really important. You can think of this analogy. Think of a moldy basement. If you've ever had mold growing in your basement or in your bathroom or somewhere in your home, you may have used bleach to kill it. So bleach may kill it, but it's destined to grow back as long as the conditions under which mold grows are still there, right? Dark and damp conditions is where mold grows. So if dark, damp conditions are still present, it'll come back. However, if you were to use UV lights or run a fan and a dehumidifier to clear out the dark and damp conditions, then the mold won't grow back. So it's a little bit like that in the body. Change your body conditions, change your body, mind, and spirit conditions so that you are an inhospitable host to cancer. But keep in mind, those changes do need to be permanent. Now, in that third category of digestive aid, the radical remission survivors were taking those to help them digest their food better. They were taking prebiotics, probiotics, digestive enzymes, etc. And those digestive enzymes can help your digestive system break down food. The probiotics are beneficial or good bacteria that live in your digestive tract and help you digest your food and strengthen your immune system. Many people are deficient in probiotics due to our culture's frequent use of antibiotics, which indiscriminately kill the good bacteria in your gut along with the bad. And the probiotics feed on prebiotics, which is why it's helpful to take both types of supplements. So the radical remission survivors found that supplements did provide their bodies with the nutrients and minerals that they needed to fully heal. Sometimes it was just another piece of the puzzle that really helped them. All right, that's the 10 healing factors. Next up, I was going to tell you my story. I am a radical remission survivor. I was originally diagnosed in 2003 when my sons were 5 and 2.5 years old, and I was 37. And then that's a picture of me in 2019. I was living with stage 4 metastatic breast cancer and no evidence of disease. So I'll give you some details. So I like to put this on a little timeline. In the beginning was sad. Before cancer, I had essentially the standard American diet. So standard American diet is SAD, SAD. And it's a sad diet and lifestyle. I took birth control pills. I was under a lot of stress in the work that I did. I drank alcohol. I had candida issues, you name it. I thought I was healthy. I wasn't really like debilitated, but I wasn't living as healthy as possible. So jump to 2003 and I get a breast cancer diagnosis. Stage 3 at 37, infiltrating ductal carcinoma of the right breast, ER/PR positive, HER2 negative. I had a single mastectomy with a deep flap reconstruction. There were 7 of 21 lymph nodes positive. So of course they recommended I have chemotherapy, radiation, and then take 5 years of tamoxifen. I did that. I didn't know any better. I did what I thought was the right thing to do. I tried some unconventional methods, got a lot of pushback on acupuncture in 2003, but eventually I did do acupuncture, but I didn't do a lot else. So I was looking to get back to normal. I wanted to get back to raising my children and building my career. And I didn't know better, so I didn't do better. I went back to that corporate lifestyle and continued drinking and taking birth control pills and eating the standard American diet. My life was full of stress, global travel, lots of alcohol. Work was stressful, so I had to come home and have a drink every night, right? I had long work days. I also experienced sexual harassment on the job. I started into menopause early, premature ovarian failure, according to a specialist who then prescribed a small dose of hormone replacement therapy, which I took. I didn't realize, even though I knew my history, the doctor that was a specialist knew my history, I really wanted some relief from menopause and from the symptoms of that. So 2014, it was 11 years after my original diagnosis. I was now 49. And it was a short time after starting the hormone replacement therapy that I had symptoms of numbness in my leg and an inability to maintain a lunge, and that eventually my leg was randomly dropping out from underneath me and I would fall down. So I worked with my chiropractor. He thought maybe I had a pinched nerve. After a couple of months of working on me with no change, he thought, well, maybe you need to go see an orthopedic doctor. Went to the orthopedic doctor. He took an x-ray of my leg, my knee down. Nothing wrong with your leg. Everything looks fine. Maybe you should see a neurologist. A few months go by, I get to a neurologist. The neurologist says, all right, well, the nerve testing is good. Don't know what's going on. Let's do an MRI. The MRI showed suspicious spots on my spine, pelvis, ribs, hips, clavicle, etc. Essentially, all the bones all over my torso. I was diagnosed with stage 4 breast cancer. So immediate changes commenced. I knew I had to change a lot of things in order to overcome this diagnosis. I hired a cancer coach. I changed my diet, my lifestyle. I certainly stopped the hormone replacement therapy and the birth control pills. I began taking a hormone blocking drug. My conventional oncologist, God bless him, he said, this is a chronic disease that can be managed. So I began to manage the hell out of it. I knew how to do that. I'm going to get this. I'm going to take care of this. Remember, I had that goal to live to be 101, healthy and sane. So I was with a conventional oncologist, but I was doing everything in my power to make the changes I felt were necessary and working with that cancer coach to help me figure out what that was and how to do that. In February of 2015, we added another drug to the mix, another aromatase inhibitor to block the hormones from feeding the cancer, and things stabilized. In that first scan, 3 months later, my cancer was stable. Nothing had grown. And I continued to remain stable for the next year and a half. But we go to 2016, and I switched to an integrative approach. And I was experiencing, I didn't experience any symptoms, but my scan showed that I had a liver tumor. And this was really disheartening because I had been doing so well. But what I had done, because of the lack of estrogen and the menopausal symptoms, and the lack of libido and dryness and painful sex, I was desperate to maintain my sexual health. I was only 49 years old. I really wanted something to help me. I spoke to 3 doctors who all recommended the E-string as a local solution, would not be systemically uptaken in the body. However, for me, 4 months later, I had a liver tumor. So that's when I switched to an integrative oncologist, and I found in him a partner in this mind, body, spirit healing that I was seeking. I also found radical remission around that time and the 9 healing factors from that book, and it became my Bible. So with a change in meds, just a slight change in what I was taking, and that partnership from the integrative oncologist who believed in diet and herbs and supplements and lifestyle changes as a way to build my immune system and overcome disease, I had that liver tumor fully resolved in 6 months. And it's been no evidence of disease ever since. So I've remained Ned ever since. I intend to keep that streak going for as long as I possibly can. And again, I intend to make that 100+ goal healthy and sane. I continue to learn lessons and apply new healing modalities and do things differently. But I'm feeling good. I'm going strong. And I am a radical remission survivor and very proud of that and blessed to have that. So as a reminder, these are the 10 healing factors. And again, no order of importance. We don't know yet which, if any, of these factors are more important than the others. All of these together can be used safely in conjunction with conventional medicine to help you reduce side effects of cancer treatment and to improve your immune function and to improve your outcome in overcoming cancer. If you're interested, there are radical remission workshops that you can find in person and virtual. We have certified coaches on the radicalremission.com website that can help you either with one-on-one coaching, or you can find an event to attend. And we do have a live event coming up at Omega Institute in Rhinebeck, New York in late May. If you'd like to, you can go to the Omega website, eomega.org, to find that event. So I'd like to thank you for your time and attention. I'd like to send you to the radicalremission.com website to learn more. And here's to your health. Now it's time for Q&A.
Thank you so much, Karla. Thank you for that presentation.
Of course, my pleasure.
So now we're going to begin the Q&A portion of the presentation. For anyone who wants to ask Karla a question, you can go ahead and raise your hand in Zoom. The instructions for how to do so are in the chat. We don't take questions directly from chat, so we just ask that you raise your hand in Zoom. So from the Radical Remission and Radical Hope books, specific dietary changes are mentioned. Can you elaborate on how these changes impact cancer cells?
Yes. So those changes, we know when you reduce or eliminate meat, wheat, sweets, and dairy, you are building your immune system up, right? The foods that we eat in the standard American diet are, chemical laden and pesticide laden, and those things are really impacting the immune system. So we know that the studies show us that by eating a diet, more plant-based diet, we can build our immune system back up, which helps us then to overcome those cancer cells and to rebuild our immune cells and our ability to clear out the cancer cells.
Great, thank you. And can you discuss the importance of community and support networks in cancer healing and prevention?
Absolutely. I think the pandemic taught us a lot about community and having people nearby and how important it is to have social support, have friends and family that are there for us. And it really doesn't matter how many people are in your social support network. What matters is that you perceive it to be enough people. So I'm an extrovert and I have a large community of friends and family and people in my life. And so for me, a lot of people being aware of it was really helpful. For others that are more introverts or just have a smaller circle of friends and family, it could be just one or two or three really important people that make a difference. And we know that loneliness is really a problem these days, and it can affect our health. In fact, the studies show that that having support is more important than having a healthy diet, not smoking, not drinking, not exercising combined. So basically, you can have all those bad habits, and the social support is more important than that. But I don't recommend the bad habits. I recommend the good habits and the social support together.
Thank you. How much influence do you believe the power of mind and positive thinking have on healing from cancer?
It's huge. I believe it's huge. The research shows us, we know that the mind-body connection is really important. I can just ask you all to imagine right now that you're sucking on a lemon. If you imagine you're sucking on a lemon, what happens? You probably start to pucker or salivate, right? Things start happening in your body because you imagined it. That is a very simple demonstration of how the mind and body are connected. And if our mind is that powerful, why not use it for our healing? Why not put it to good use? And that belief that you can heal, the belief that you are worthy of healing, that makes a huge difference in your healing journey. And for me personally, mindset and belief are a really big part of my personal journey.
And actually, let me just ask you a quick question. So you said you're very positive. For somebody who's not naturally positive, any thoughts on how they can become more positive?
Yeah, and there are pessimists, right? Or they're realists. And that's fine. You don't have to be positive all the time. That 5 minutes a day of increasing positive emotions. Watch something funny or something inspiring, or listen to something inspiring. Maybe it's prayers, or maybe it's gospel music, or maybe it's, whatever, for you that you find inspiring and uplifting. If you can do that a little bit each day, you start to notice that it makes you feel better. And then when you get that low vibration emotion, that negative, or you're worried, you're ruminating on something, you're having a negative thought about something, you can catch yourself and you can say, wait a minute, I want to choose a better response to this. Maybe you put on a great song and dance a little bit to shake it off, to get it out of your system, right? Maybe you go take a walk. Maybe you do some exercise. There are lots of things you can do to, change that cycle of rumination. It only takes 6 seconds to switch from that fight or flight sort of mode, that negative mode, that chronic stress mode, 6 seconds. So if you can just think of something for 6 seconds or do something for 6 seconds, that can really help you get back on top of it.
Thank you. How does stress influence cancer progression, and what are the effective strategies for managing it?
Well, stress management, as I said in the presentation, is really important. And the studies have shown that a single meditation session can really benefit our bodies and change the expression of our genes. So stress management is, I think, critical for everybody, not just people with a cancer diagnosis. But because you are going to feel the stress of that diagnosis, you are going to feel the fear of that diagnosis, working towards managing that stress in a positive way is really important. So doing something that makes you break that cycle of stress. Again, exercise can be good, meditation can be good. Being out in nature can be good. Anything that takes you out of it. I know someone who just continually listened to positive and uplifting podcasts or music, or had somebody else in their head while they were dealing with this fear of a dire prognosis. So, if it takes that listening to something all the time to override your own negative feelings, do that for as long as you need to, because you do need to get your body back into that the rest and repair mode so that healing can happen.
What specific advice do you have for individuals who have just been diagnosed with cancer?
I love to tell people, although I don't really, get a chance to tell people before the diagnosis, but I love to tell people to take a deep breath, to relax. Most of the time, a cancer diagnosis is something that isn't urgent. Now, there are cancer diagnoses that are. There may be an aggressive, fast-growing cancer that needs to be immediately dealt with. But even taking a day or two to decide what's right for you, to really just try to take some deep breaths, to get yourself back into that rest and repair mode, right? So that you can make decisions that are right for you. And for those of us that don't have an aggressive, fast-growing cancer, take several days, take a few weeks. When I was very first diagnosed in 2003, the doctors, the oncologist, physician's assistant told me, this is not a physical emergency, but it may feel like an emotional emergency. And that was very true, but it was great advice because it gave me permission to say, okay, I don't have to rush into surgery. I can do some research, because I was faced with, do I do a lumpectomy? Do I do a mastectomy? Do I do a double mastectomy? And I needed to look at what else that meant and what kind of surgery I wanted to do. And so getting a second opinion, taking time, getting a second opinion, really listening to what's right for you is an important step when you get that news.
Thank you. What are the most common themes you've observed among people who have overcome cancer?
These 10 healing factors are really common, right? And everybody can apply them in a slightly different way. So some people may use different modalities to achieve releasing suppressed emotions. Someone might use emotional freedom technique to release. Some people might use trauma therapy or EMDR, or, some people may be able to release their trauma or their stuck emotions just by dancing it out or with, music. Whatever it is, the modality may be different, but it's these 10 lifestyle changes that have really made the difference. And a lot of reframing often needs to happen, right, in order to be able to make these lifestyle changes, right? Just like I talked about with exercise, reframing it to physical activity. You know, if you're not a person that likes to exercise, you don't like to get sweaty. Well, let's just get started by taking a walk every day, and then walk faster, and then walk longer. And then maybe you want to start adding in a bicycle ride or some other types of physical activity and movement.